A lot of people say to me, "You're the weight loss surgery guy, right?" I go, "Yes, but we do other things." And one of the biggest myths about Advanced Surgical Partners of Virginia is we just do weight loss surgery. We do everything general surgery. So while we have a passion and we help patients with surgical weight loss, we also do general surgery. And one of my biggest passions, other than bariatric surgery, is hernias. Love to take care of patients who have inguinal hernias or belly button hernias and help patients get rid of the pain and discomfort associated with a hernia and get back to their normal routine, especially when it comes to exercising and doing heavy lifting and things like that. We're fortunate that we partner with a lot of schools in the area, colleges, and take care of patients who have sports hernias. So patients who may develop a hernia related to soccer, baseball, basketball, we're able to help those patients get taken care of quickly, get their surgery, get back to normal activities, and get back to their sports. So what is an inguinal hernia? An inguinal hernia is a hole in the muscle that allows tissue from inside the abdomen to poke through that hole and cause discomfort either through tearing that hole and making it bigger, causing pain like a muscle strain, or all of a sudden a patient developing a bulge in their groin or at their belly button and saying, "Hey, what's this alien I've got here?" Now, once you develop a hernia, it doesn't go away on its own. It only gets bigger and usually becomes more symptomatic. So when you're diagnosed with a hernia, we like to take care of it at your earliest convenience. It's not an emergency, although there are things you have to be concerned about. One of the things you have to be concerned about, and this is true especially of golfers and people going away on trips and carrying their own luggage, is that the tissue may poke into the hernia and get stuck there. If that happens, that's called an incarcerated hernia. And that's something we really want to reduce or push back in as soon as possible. And if you're a patient and you have a hernia that all of a sudden gets stuck, the best thing to do is stop what you're doing, lay down, relax, maybe put some ice on it, and push it back in. If it doesn't go back in, that's kind of an emergency, and we need you to go to your doctor or to the emergency room and see if they can reduce it. If they can't, that hernia will need an emergency operation to take care of it and reduce the contents so that it doesn't swell up and possibly the blood supply to the contents of that hernia get cut off and cause the tissue in that hernia to die.